Okay. Okay, so thank you guys for coming to Breastfeeding How to Stay the Course. I'm Dr. Jessica Daigle, known as Jess. I'm a board certified pediatrician and NICU doctor. And one of the reasons I decided to give this talk is working on mother, baby, and then the NICU. I see a lot of moms get discouraged with breastfeeding, a lot of it partially due to the fact that a lot of folks in healthcare actually have to become more abreast about breastfeeding medicine. And actually, well, recently, a lot more physicians have become more interested in breastfeeding. It used to be traditionally something nursing would do, but I've actually joined a breastfeeding, doctors who do breastfeeding group because I wanted to strengthen my knowledge and support of families. And so one of the things that a mom I helped recently, we talked about like how to stay encouraged. And I was like, that would be a great talk to give. And so that's how this webinar was born. All right. So this is a disclaimer. This is educational only. So while I am a physician, I'm not technically your physician. And so if you have medical concerns about breastfeeding your baby, definitely reach out to your OB provider, pediatrician, and our local lactation counselor for evaluation, only because they will know a little bit more about your medical history and kind of can do that deep dive to make sure you're getting the right information that you need. So what we're going to talk about today is going to be the benefits of breastfeeding. Important to understand why we do it. Some barriers or pitfalls that moms have to breastfeeding, and then some things that you can do to start your breastfeeding journey. And also building and maintaining milk supply. That's something that often comes up. Which it sounds real deep, but it's really some real simple things, but it's often the simple things that we find kind of hard sometimes. And then some tips for staying motivated as well. So my story. So actually, like I said, I'm a pediatrician, but in medical school, we learned the benefits of breastfeeding, but really didn't learn about like milk supply and all the different parts of it and the struggle and work that goes into breastfeeding. That's something that I learned personally. And so I lost my first baby to miscarriage, but my second son, and that's him here at the top, he was actually born preterm. And so, sorry, someone else coming in. Okay. He was actually born preterm. And so I remember like that day, about, a few hours after I had him, I'm in the room and a lactation consultant comes in and she's like, yeah, so you need to start pumping. And I, so, I'm engaged because I've learned the benefits of breastfeeding. So I'm like, okay, I know I need to give this to especially my preterm infant, because it's definitely beneficial for preterm infants. And so I get like these little drops and I'm like, what can I do with this? And she was like, no, that can be used for mouth care. Like you have to keep going. Breastfeeding is like supply and demand. And so I kept pumping around the clock because he couldn't feed at the breastfeed in the NICU. So I kept up the schedule of every 2 to 3 hours. And then eventually, like this was like 2 or 3 days later, this picture right here, I was so proud of that little 15 mLs of colostrum that I got. And I felt like, man, I'm doing my part to help my baby. And so then I continued on to breastfeed. I did have to supplement him because of him being premature. I had to add powder to my milk to get him calories, but I was committed to the breastfeeding process. And by the time he came home, he actually didn't want to eat at the breast, but I still did skin to skin because that does help with milk production, which we'll talk about that. And I still kept up the pumping as if he was eating at the breast. And so I'm a big fan of making sure families are not ashamed of the fact if you have to pump, if your situations where you have to pump and your baby's not necessarily latching on, that is still breastfeeding, and you should still be proud of the fact that you are providing your baby with that breast milk however you need to do it. So this is me with my second daughter. She was also preterm, but a little bit longer, and she was actually able to feed at the breast. And so that was such a good experience of having her being able to latch on and seeing that I was capable of that too, because that's one of the things too, like, will my baby latch? Can they latch? And that's one of the things that sometimes moms can struggle with, is wondering, is their baby capable? And I always tell my families, every mom, baby, and breast combination is different. And so definitely don't despise your small beginnings. The key is to seek the help that you need when it seems to become too much. And then this is just the pump that I use. So I used a hospital grade double electric pump with my son, and I still had it for my daughter. And I used that when it was time to return to work. And we'll talk about that too. Okay. So why should moms breastfeed? So the American Academy of Pediatrics recommends feeding for at least a year, first 6 months exclusively. And that's just because of the fact that around 6 months is traditionally when you begin solids in babies. So the exclusive is means that specifically. And then the World Health Organization actually recommends going at least 2 years, which they're more concerned about internationally and globally, where a lot of resources are limited in a lot of other countries and areas. And so it's really, really important for those families to breastfeed for sure, because that really is usually the nutrition that the baby is going to get. So it's two parts to this. It's healthy for the baby and for the mom. And so for the baby, breast milk is filled with rich nutrients. Okay. So you get that colostrums at first. You hear about that. That's filled with those antibodies and those cytokines and things to fight infection. And it's also water, fat, protein, carbs, vitamins, minerals, all the things that you need for nutrition and growth. It's also easier to digest. Digestion is a big part too. It's easier to digest in formula. So formula contains casein and whey. These are two proteins, and breast milk has some of that too, but it has more whey, which is easier to digest, whereas formula has more casein. And so babies digest it a little bit more slowly. So that's one of the reasons too why breastfeeding babies will feed more frequently, is because that milk goes through them a little bit faster. So if you're already breastfeeding, you already probably have experienced the baby pooping almost like with every feed, and that's part of it, but it's actually better for their digestion. And then the biggest thing is fighting infection and diseases. So I mentioned those antibodies and cytokines, things that help support and build the immune system. And so these things lower the risk of ear infection, asthma, lower respiratory infections, diarrhea and vomiting, because you get that IgA, which helps with the gut or the bowel. And it reduces the risk of childhood obesity, eczema, and type 2 diabetes. So it really has a lot of benefits for the baby. And also the brain, right? The brain is huge. This is how your baby's going to learn and grow and develop and become a part of who they are. And so breastfeeding helps get their development off to a good start as well, and lowers the risk of SIDS, sudden infant death syndrome. So that's where you hear of the crib deaths associated with babies, or found asleep, unfortunately pass away in their sleep. And so it's helped to lower the risk of these things. But we don't ever want to forget about moms, right? Moms matter too. And that's one of the big things with my business, is making sure that moms are not forgotten. And so with moms, it helps with childbirth. So you recover more quickly. You release an oxytocin, which helps reduce that uterus, that contracting, kind of get it right back down to size. And also then helps with postpartum bleeding. And so that's released during breastfeeding. Breastfeeding also helps moms as well with their own health, with breast and ovarian cancer, type 2 diabetes, and heart disease. And also a benefit is helping you lose some of that weight that you gain when having a baby. So, because you can burn up to 500 calories daily with breastfeeding. And then it's good for mom's mental health. So that skin to skin contact and bonding often helps with the mood. You're having a powerful and emotional connection with your baby. It boosts the levels of prolactin, which helps your milk production, and the oxytocin promotes the flow. So they're kind of like the production and flow team. And so they work together to give you this peaceful, nurturing sensation, and allows you to relax and focus on your child. But what are some barriers and some struggles to mom breastfeeding, right? Because I know for me, I personally didn't know all of the things that can come your way until I was in it. So while you can do a lot of reading and someone can tell you, it's really not until you're in it, right? Like with most things, that you start to realize how how time consuming and things it is. So that's one of the first things, is that it is time consuming. Like the baby is always with you. You can become tired because it's around the clock, which I always like to tell families that's anyway with a baby, around the clock feeding until they get close into those 4 and 5 months. depending on your child when they start to learn how to sleep a little bit more through the night. But it is around the clock, and it can be time consuming. And so that's one of the factors that can influence some moms' longevity when it comes to breastfeeding, for sure. And then the other thing is concern about milk supply. So one of the biggest things that rightfully so, like you want to make sure your baby's getting enough. Like you only have a couple of things you have to do, like keep them safe and keep them fed, right, and clothed. And so one of the things a lot of moms will say is like, well, I can see what I'm feeding them when I give them a formula bottle, but I'm concerned about my supply, and especially that first 24 hours when they're doing what's called cluster feeding and they want to eat all the time, and you're making colostrum, which if you're hand expressing, you might get some drops. Actually, that is enough for your baby, especially your term baby, who is still full with amniotic fluid and has grown well enough to be able to sustain first 24 to 40 hours to 72 hours of just that kind of milk. And so I'm personally working on educating our nursing staff at the hospital not to rush to push formula on a mom if the baby is latching well and showing good wet diapers. These are the things that we use. We assess the latch. Are they, having good wet and poopy diapers? We look at weight. All of these things are factors we can use to determine if a baby is getting what they need. And so if you feed your baby and then you follow with a bottle and they eat, well, babies are naturally they're nutritive suckers. So they will suck just because it's part of a reflex and it does soothe them. And so just because you follow with a bottle and your baby juggles down 30 to 40 mLs of formula after a breastfeeding session does not necessarily mean that you were starving them. They were more likely would eat that anyway. And so sometimes that can give moms a false sense that they've been starving their babies and thus enters into that cycle of, oh, I've been starving my baby, when actually you were doing fine. It's just that information was needed. And then one of the biggest third things is return to work and childcare concerns. So in this country, especially, is a big push to return to work. People are going back to work in 6 weeks. Some people are able to take longer depending on their job. But if you look at other countries, they're really supported when it comes to like after delivery. Some are even supported by their jobs to be able to take like that whole year off. And there's a big focus on breastfeeding. Whereas over here in the US, where we actually have more resources to be able to do that, that is not our practice, unfortunately. And so here are some other barriers, okay? Lack of knowledge. So just some people just don't really know like how beneficial breastfeeding is. And it really can depend culturally. So I asked my mom if she had breastfed me when I was younger, and she told me yes, but really, I didn't really have any other contact with any other. I'm an only child, so I didn't have any siblings or anyone else that I knew by the time I had my kids that were breastfeeding. So it was really me relying on the fact of my medical background that kind of helped me to kind of push myself a little bit more. But not everybody has that added benefit or quality, so to speak. And so sometimes if you're in an environment where the family is like, man, just give that baby a bottle or things like that, it can really be discouraging to moms, or even like I mentioned in the hospital, where the lack of knowledge of medical staff. And so if the nursing staff are not comfortable with or understanding what to expect, especially those first couple of days with breastfeeding, then as soon as there's any discomfort, instead of encouraging the mom and teaching through that, a lot of times there ends up being like shame and disappointment and then formula push. And so the other barrier is misconception about formula. So I'm definitely not one of those providers that shame people. There are definitely instances where babies have to have formula. A lot of times if there's a preterm infant, they're often very sleepy and can't really sustain being at the breast that long or they have a weak suck or things like that. And their glucose sugar is dropping, as we have to check that in preterm or small for gestational age babies. Then sometimes formula is necessary in that regard. The other thing too is that while formula does have some of the vitamins and minerals, it doesn't have the immunity benefits. And so really stressing that is different in that way. And then we have formula companies that are marketing themselves like, oh, we're just like breast milk. We're kind of making like breast milk. And really, try as they might, it's really not the exact same. So sometimes people get a false sense that it's exactly like breast milk when it's not. And again, that lack of knowledge, and then that not having that support, and no family or social support. So either that could be like physically, like
Hmm.
when I had my son and my kids, it was just me and my husband and my kids in town. I'm from Louisiana. So it was just really us. It was no one else to call to help to do things or around the house or things. It was just us all the time. And so sometimes that is a barrier, because it is easier to when formula is involved to be able to say, hey, can you feed the baby for me while I do X, Y, and Z, versus if people have things set up ahead of time, like meal prep, or someone to come clean their home, or just things like that, other things that you might be doing, taking time to do instead of being able to just bond with your baby. Not having those things can be a barrier. And then embarrassed to feed in public. So I think that's becoming maybe a little bit less as much, but definitely for some people, they don't like the idea of having to feed their baby that way in public, even with all of the cloths and fancy clothes and things you can get nowadays. And even though some businesses are attempting to put like rooms and things like that, we still have a long way to go, like in terms of making the environment a little bit better for our moms who are breastfeeding. And then lastly, lactation problems and even health challenges. So barriers as far as like some moms have had to have breast reduction, breast cancer, things like this. Um, Also, if the baby, him or herself, is not latching well, if moms have some medical conditions like polycystic ovarian syndrome or issues with their thyroid, there are even infectious diseases that are easily transmittable through breast milk. These are sometimes some barriers to actually breastfeeding. And so it's definitely important while you're pregnant to discuss with your OB and even a lactation consultant if anything in your medical health could be challenging for you as a breastfeeding mom as well. So getting started, preparation is key. So like most things, right? Like we've already discussed, sometimes it still doesn't matter until you're in it, but it's still good to know some of what to expect. Just like when you go to have your baby, you know to expect there's going to be some pain, that you could get epidural, this and that. And so there's a choice to be made, and then you can make that decision because now you've had that information. And so the same way with breastfeeding, there are definitely books and websites out there, and I'll compile a list and send it to the you guys' email addresses, of good websites and some books that you can read ahead of time. But there are three parts to it. It's like during pregnancy, at the hospital, and at home, ways that you can prepare. So during pregnancy, it's good to do something like this. Take a class on breastfeeding, read books and things that you want to be learning about. It's about latching, like what does a good latch look like for your baby, the different positions that you can breastfeed in, when should you think about pumping, and dealing with things like engorgement and things like that. Like we mentioned, talking to your OB about health challenges, because one of the things is like when you don't have information, right, frustration comes. And so the more information you have, where you can make an informed decision, then oftentimes that kind of helps you to deal with things that come your way a little bit better. And then you can even find a lactation consultant that you can connect with ahead of time. So it doesn't have to wait until after the baby is born. You can figure out who's in your area, in your community, that you can work with, who can support you after you have your baby. Even some moms are interested in collecting a little colostrum ahead of times, even though you should talk to your OB about it, because you can induce yourself into early labor, which is not recommended. So definitely don't do that without talking to your OB and our lactation consultant beforehand. And then free up time in preparation for breastfeeding. So what I mentioned, one of the things before is recognizing that breastfeeding is going to be, especially that first few weeks when you're trying to establish that milk supply, you really need to be focused on just you and your baby and breastfeeding and rest. And so anything else you can get other people to do, do not be afraid to ask for help. It is so important. I know a lot of women, we think the more we can do, it's a badge of honor, strength. But I think that the tide is changing on that, where people are realizing like it's not important to be able to do everything. You can ask other people to help you get things done that you need to get done. And so then at the hospital, skin to skin immediately and latching as soon as possible within that first hour. And it's something that we work on at our hospital, even for our moms who are having cesarean sections. Check with your OB provider, the hospital, tour the hospital even beforehand if you can, where you plan to have your baby, and see what do they offer in terms of supporting you for breastfeeding. So like one of our nurses just had a baby last week, and we got the baby right on to her chest, even in the OR, just to start that closeness. And understanding too that your baby will cluster feed. So I give my parents this talk like, hey, your baby's going to want to be on that breast almost every 1 to 2 hours. This is normal because breastfeeding is supply and demand. They are trying to help you get that supply up. And so the way to do it is naturally through your baby helping you to do that. And so it's because your baby is going to help you to increase the amount of milk that you need. And then lactation help if there are counselors, excuse me, at your facility where you have the baby. That's always good too. Sometimes there are some nurses that are a little bit more versed. Either they have become lactation consultants themselves, or they breastfed like 3 or 4 kids and things like that. I often find they have a wealth of information inside of them too, even if they didn't go and get trained. I still respect that knowledge because being in it, the experience is definitely one of the biggest things too. And then at home, so you want to continue feeding your baby frequently to establish the supply. Usually a good supply is established right around the end of the first month or so. I would say definitely into the 3rd or 4th week. Making sure your environment is comfortable. So if you think about it, most things, right, when you're uncomfortable, you don't want to do it, right? You're like, ugh, I'm uncomfortable, I want to stop. And so making sure you're as comfortable as possible will help you be much more successful as well. So when I'm helping moms at the hospital, one of my tips is, if they haven't brought one of the boppy pillows or the nursing pillows, I bring pillows, like 2 or 3 pillows to stack into the corner. And I always say, stack your baby up to the level of your breast. Because ideally you will want to have 3 hands while you're breastfeeding, one to hold the head, one to hold your breast, and one to hold the baby. So since we don't have 3 hands, you want to definitely have that support where your baby's body is able to be supported. And then all you have to do is focus on supporting the head and making that C shape with your breast to make that nipple sandwich, like I like to call it. So that way you make sure your baby has a good latch. And I always tell my moms, you want to make sure that the nipple is in the mouth, as much of the areola is in the mouth as possible, because you don't want your baby at the tip, they'll be biting like that, and you'll hear smacking, but you want them to be here because the idea is they're supposed to do just like this, like a little tug on your breast. And so that's how eventually you want to get to that point where it's comfortable. And mamas, you do have to be involved, especially that first month for sure, because I see a lot of my new moms will just put the baby and take their hands away. Like, all right, baby, get on it, get with it. but you have to help all of you. You are learning, and so is your baby. And so while some will go to town right away, I have seen that some babies like will get on and just get going with the latch. It's still important that you are actively involved, forming that breast, supporting that head, and it's an active and involved process. And then lactation consultant, even as you need at home. And so don't be afraid if you're concerned, like it's feeling uncomfortable. I don't know if my baby's getting enough, things like that. Before you jump to giving formula, have a conversation with the lactation consultant, with your pediatrician. And I have to be honest with you, a lot more of physicians, more than others, are into breastfeeding. And so, because like I explained, we learn the benefits of it, but it's almost like anything else. If you want to get extra education, you almost have to pursue it on your own. And so that's what I've even found for myself with breastfeeding. I've had to go do a lot of more education on my own so I can support my moms. And so sometimes pediatricians and our family medicine doctors can give some conflict information, probably even to that of your lactation consultant, depends on their knowledge base. So, it's continuing medical education, I always say. So we all should be learning more and better on how to take care of our patients, but everybody has different levels of commitment to that. So just keeping it real. And the other thing is taking care of you. So you are important. You are a big part of this process. Your mental health, your mindset, your nutrition, your self-care. When people say sleep when the baby sleeps, that is true, but I know as a mom myself, I only felt comfortable doing that when I know other things that I was concerned about, like my house, like the meals, like laundry, were being taken care of. So definitely, if you can have support for those kinds of things, that's part of self-care to me. So that way you can focus on just you and your baby, which is what most moms would want to do. It's just that real life doesn't stop either, right? So you have to have a plan in place to be able to make sure you're feeling as supported as you desire and as you need and deserve. Building and maintaining supply. So it really is the baby, you and the baby are the biggest part of building and maintaining your supply. But here are some things to think about. So make sure that your baby is nursing efficiently. So a latch assessment, that's the biggest thing, like getting that latch effective is key. Because again, if your baby's not latching well, they're not going to empty the breast properly, which will affect milk supply. It will hurt you. And so think about that, like anything where it's painful, like you bump your knee, then you don't want to use it, right? And then you're in that cycle because, well, you need to use it to get better, but then it hurts. So it's the same way with the baby latching on. If you get shaft nipples or bleeding nipples or things like that, then you're gonna be afraid because it's painful to breastfeed, and so then that's gonna discourage you from feeding, which is gonna affect your supply. Nursing frequently for as long as your baby's actively nursing. So one of the reasons I bring this up is because you'll read a lot of things on the internet about, oh, your baby don't need to be on there 15 minutes or 10 minutes or 20 minutes. And it's really like you should let your baby guide you. And so they're going to want to do longer at first because they're, again, helping you get that milk supply. You got to tell yourself, my baby is helping me build supply. And so, realizing that that's definitely going to be the case those first few weeks, definitely those first few days and first few weeks for sure. And so if your baby is happy on that right breast, let them go. And then when they're done or they fall asleep, you can decide to switch, which is where this tip 5 down there, switch nursing. If baby is sleepy or low supply, that's a little tip. If they start to get sleepy on that side and it's been 15 minutes, switch them to the other side and see what they do. That'll keep your supply relatively equal to in both breasts. Taking a nursing vacation, meaning plan to be around the clock with your baby and that be your focus, just again, to get that milk supply. It's kind of like doing the work up front to have that long-term benefit later, where it's regular, it's anticipated, your baby's going to get what they need, but you got to get that supply established and then you can maintain, right? So build up to maintain, build up your stores and maintain. Offer both sides at each feeding, again, seeing what your baby does and then switching over, and they'll let you know if they're really full. They may not want to do anything on that other side. I took that opportunity, especially when I knew I was going back to work. I would go ahead and pump that breast and then store that milk. So that way I would just have a little bit for when whoever would feed them and things like that. So it's definitely a lot of different ways to do this. But you want to be careful with pumping too, because sometimes that can get you engorged if you're not doing that right. Avoiding pacifiers and bottles when possible. So really that more so has to do with helping to build up your supply. A lot of people kind of argue about the nipple confusion and things like that. For me, it more so had to do with the supply, allowing your baby to, quote, use you as a pacifier at first, at least until that supply is built. Then after that, once you know, okay, I get this regular amount. I know they really typically eat about 30 minutes, and now I know they're full and they just want something to do. Because again, babies are non-nutritive suckers too. Like they will just reflex suck is soothing. Then in that case, you can consider if you want to do that. And my daughter, she threw it at us like, why are you trying to shush me? And my son, we had to like go to Disney and Pride and have a ritual. So you see, it just depends on which child you get. And then give the baby only breast milk too. So again, what we talked about earlier, like sometimes the temptation is to give the formula because you think that you're starving them. Well, then that's going to make them full where they won't want to like always eat and help you build up that supply. So you definitely want to be careful of that because you almost need the hunger to help the supply, and not in a bad way, but knowing that you're you have a purpose. The purpose is to get the supply up to give your baby what they need. So it's thinking again long term, what are you trying to achieve? And again, taking care of you, hydration and nutrition. If you're not eating well, if you're not well rested, if you're not hydrating. So one of the things that I used to do is just have a snacks around. I like to snack anyway. So snacking while you're feeding, apples, bananas, oranges, carrots, some good snacks. And there are things you can Google, like good breastfeeding snacks and things like that, and see what kinds of foods you like to eat. But make it where it's comfortable for you and you're feeling empowered to breastfeed, okay? Because you can be empowered to breastfeed. So here are my tips to stay motivated. Um, the biggest one is reminding yourself of the benefit of breastfeeding. Okay. Um, it's with anything, it's kind of like if you think of anything that you've done, if you're on here and you're a doctor or you've been in school or went to college or just whatever long-term thing that you've done, right? A lot of it was hard. Like, I remember at my first year in med school, I went to the dean's office and I was like, I'm done with this. I think I'm just going to go to like get my master's and, help moms, or whatever, some other kind of way. And he was like, go study. So I had to then also think, what is my goal? What is my end goal? What is the benefit of me becoming a pediatrician? Oh, okay, I get to help my moms and babies like I envisioned. Okay, so what is the benefits of breastfeeding? Immune function for my baby, better weight control, better digestion, lower risk of infection, good brain health, lower risk of SIDS. What's the benefit for me? Oh, okay, I get these good hormones released to help me with being calm and helping my flow, reducing my risk of heart disease. It's just sometimes it just takes reminding yourself that there is a benefit. The second thing is making sure you are comfortable. So again, if you're not comfortable, then you're not going to want to continue to do something. So playing around with positions, and I can send like a little chart thing I have with the pictures of different positions. But I personally love the football hold because I love tucking my baby into the corner there. And I love that it gave me the sensation of arm curling. So I would bring my baby up to the breast, and then I would just be watching a little show or something or talking, for those 20 minutes or so. She would breastfeed. And then before you know it, it was time to burp, put her back down, and then, go on until the next time. So definitely making sure comfortable. I definitely had the little nursing pillow. And again, it helped to bring my babies up to my breast. So all I had to focus on was these two hands and not like trying to like hold the baby up with my hip and my arm and all these things. Like that doesn't inspire anyone to keep doing anything. The third thing is partner or family support. So identifying who can help you in terms of the things that would frustrate you, like around your house, like, oh, some people are a little bit more like orderly. So the idea of things being all over their house frustrates them, and that becomes a focus. And so asking your partner, since when you're breastfeeding, you are the main person. So hey, honey, you don't have to feed the baby. So do the groceries or do the dishes, or can you cook a meal or have some friends bring some casseroles over a couple of times a week or things like that. I'm sure there are people willing to help. A lot of times we just have to ask. Community, right? So finding other moms who have done it. That's the biggest thing, because they'll be like your cheerleaders. We need cheerleaders. So there are groups online. There's a La Leche League. There's, like social media. There are local groups, lactation counselors, lots of people that are willing to help you on your breastfeeding journey. It's just more so tapping into those resources. Take it one day at a time, literally. Like, so sometimes we have the goal, like, okay, like I said, the AAP says to breastfeed for a year. So sometimes it can be intimidating thinking, oh my goodness, like a year. Okay, let me just start with this week. I'm going to breastfeed this week. And then, oh, look at that. I made it a week. And oh goodness, look, it's actually gotten easier. Okay, now I'm into the third week. Okay, now I'm into 6 months. Actually, we on a roll now. A baby's eating a couple times. I maybe go a little bit longer at night. I might pump once or twice in the night or something. And like me, that's the time I chose to pump and let my husband feed my daughter so I can get some sleep. So there's different ways to definitely achieve getting a little bit more rest as it gets easier. And that's like number 6. It gets easier. It really does. And that's where the community comes in, because when it's your first time, you don't know that. You're like, I'm just tired. That's all I know. I'm just tired, and this baby want to be on my breast all day. Okay. But your community of breastfeeding moms and lactation counselors say, girl, I was there, and look, X, Y, and Z, and look now. And so then you'll be like, okay, well, I see so-and-so has made it through, and I can do it too. Right. And then number 7, you have a choice. So you always can stop. And so sometimes it's not like to be like an scapegoat, but realizing that you are empowered to do this and as you need to, and forsaking the pressures of others or comparison, because I'm not a fan of comparison analysis and all of that. Like, you have to walk your journey for sure, knowing the benefits, right? Like, making it work for you and your baby, but always knowing you have a choice sometimes can take the pressure off. Like, you know what, if tomorrow I just wake up and decide I'm done with this, I've done it, and I'm done, and that's your right. And number 8, taking care of you. I've said this repeatedly, and I'm going to keep preaching it, because that's, if you don't set that tone for yourself, especially as a new mom, you'll find yourself always in the back burner, and then eventually that breeds resentment and frustration, because you are a vital part of taking care of your children, your mental well-being and health as well. So, and it's not being selfish, it's actually teaching them good patterns to consider themselves when they get old. That's the way I look at it. Like, I'm teaching my kids how that they're important too, and they need to consider themselves even while considering others. Okay. And let's see. And so the biggest thing, if you don't remember anything else that I said today, is breastfeeding is a marathon, it's not a sprint. And so you take your time, pace yourself, get the information that you need, get the help that you need, take your deep breaths, and just, and know you're not alone. That's the biggest thing. You're not alone. Let's see. And so breastfeeding is a personal journey. Okay. I mean, it's definitely beautiful. And like I have here, whether you do it for a week, a month, a year, or more. I remember when I breastfed my kids, I got close to I did the exclusive, and I kind of tapered off a little bit, probably around like 10 months or so, in preparation for them just going to like regular milk or whatever. And I remember thinking about my friends who were still breastfeeding, and their kids were like 18 months. And at first I was like, well, why didn't I? Then I realized it was my choice. I was emotionally done when I was done. And I felt good about it, because I felt like I had put everything that I had into it, and I didn't feel any shame. And so that's very important. I think it's good that my friends who went the 2 years or more, I know some people don't went to 3. For me, them having teeth was where I drew the line. So everybody have those hard nose. That was mine. Okay. Do it as long as it feels right for you and your baby. And simply put, it really takes the right information, support, and commitment. And so there is a lot of information out there. Work with an individual that you trust. Don't be afraid to ask questions. I love when patients and families ask me questions, because either it teaches me something I didn't know, or it helps me to see a different way about something I may have been thinking or sharing. And all of it is for the benefit of the family. And commitment is important as well. Thank you.